Welcome back to the latest episode of Taking Charge of My Cancer podcast. And I'm so thrilled to have such a special guest with me today, Meryl Alappattu. And Meryl is a PT, DPT, and PhD, graduated a Doctor of Physical Therapy from the University of Florida, UF, in 2008. After graduation, she completed a year-long clinical residency at the University of Florida Health in Cancer Rehabilitation and Pelvic Health, and has continued her clinical work specializing in rehabilitation for patients with cancer and pelvic health issues. Dr. Alappattu completed her PhD in Rehabilitation Science at UF in 2014, studying mechanics of pelvic pain in women, and is currently a research associated professor at the UF Department of Physical Therapy and a clinical research scientist at Brooks Rehabilitation. So Meryl, thank you so much for being with me today.
Of course. I couldn't say no.
Yeah, of course. So Meryl and I come back, my goodness, when I was exposed to cancer for the first time back, has been going into maybe 15 years now, 14, 15
so.
years.
Yep.
So you were working at the Davis Cancer when I came on board, and again, her passion, and she has what we call it. You have clinicians who are very clinical, and you have clinicians like her that is very research head. So that's who she is.
Mm-hmm.
And I learn a lot and really passionate about what she does. And then we worked together for a little bit, and then she just went full time at faculty, and we continue still collaborating and working together at this point.
Yeah.
So it has been really fun. So you want to tell us a little bit about your role or your mission, and were you always planning to do this?
Yeah, so I graduated from UF's Doctor of Physical Therapy program back in 2008. And there was an opportunity at UF Health to do a cancer rehabilitation residency. So it was a sort of a joint effort from the University of Florida and UF Health. And so I interviewed and I was accepted for the position. It was the first year of the residency program. So it was a little bit flexible in terms of the education in the residency, the clinical experience, but it was really great because the program itself at that time was still developing. And so I was exposed to patients from all sorts, with all sorts of different cancer diagnoses, was able to work really closely, not only with my own colleagues in rehab and physical therapy, but with massage therapy, speech language therapy, occupational therapy, medical specialties as well, radiation oncology, surgery, urology, urogynecology, and gynecology as well. So cancer rehabilitation and pelvic health has always been an area, an interest of mine. My research sort of has dabbled in a bit of both, but more recently has taken off more into the pelvic health rehabilitation, but still very interested in and doing work in cancer rehab as well. So I'm a full-time faculty member at the University of Florida. My primary role here is to do research, to write grants, to get grants. That's the goal, right? To publish papers, and then collaborate with clinicians. Because ultimately, my mission, if I think about what it is that I want to do, yes, if I write a paper, that's great. Yes, if I get a grant, that's great. But ultimately, I want my work to impact clinical care and impact the quality of life of patients. I think for me, that's sort of my big picture goal. And so even the work that I'm doing and the research that I'm doing, I think has shifted into more patient-centered type research as opposed to mechanistic type research, which I was doing a lot of during my PhD. And so really happy and pleased with the direction it's taken.
And we so appreciate that, Meryl. As we know, we have, for years, evidence-based wasn't our strong in physical therapy in general, right? And we come becoming better and better and better. And I think that's kind of like the directions we need to try to continue taking on for really, if we now have a DPT and then we have, direct access and all that, we need to make sure that other healthcare providers know how much we know and how much is the evidence to really make it more valid, right? So when we talk to a physician and say, this is why you need to come and send the patients to rehab, not just necessarily for cancer, but any other diagnosis, we have all that evidence to back us up to see,
Yeah.
important and how much quality of life we can improve on these patients, specific on the oncology world. So
Yeah, and I think, or if we think of outpatient orthopedics or sort of your general musculoskeletal practice, there's a lot more research in those areas, whereas cancer rehab, I definitely think our evidence base is growing. There's a lot of really talented researchers and clinical researchers out there that are contributing to what we know about cancer rehab and how we can make our programs and treatments more effective. And I think the same thing goes for pelvic health rehab as well. So those are, I think, two areas that are definitely growing in terms of the evidence base.
yes, awesome. What good resources would you advise patients to look into to educate themselves?
So the three that really come to mind for me, I mean, I think obviously if you're getting treatment at a particular institution, finding out about the institution itself, the physicians that you're seeing and getting a sense of who they are, what their background is. But in terms of educating themselves about cancer and treatment and, even things like clinical trials, three primary resources come to mind. So first would be the American Cancer Society. Second would be National Comprehensive Cancer Network, and then the National Cancer Institute, which is part of the NIH. And so all of those different organizations have information online that are for patients. They're patient resources. The NCI as well has information about clinical trials that are ongoing. And so, I think in terms of established organizations, those are ones that I think are great. The other thing, maybe we don't talk about enough or put enough emphasis on is social media. And so sometimes the social media gets a bad rap for misinformation or, whatever. But I think social media, the purpose of it is social, right? To connect with people. And so I think finding people that are going through treatment for the type of cancer that you have, finding support networks or support groups, whether it's Facebook or Instagram or whatever it is, finding a group of people that can understand what you're going through and can provide you support, even if you don't know them. I think that's really powerful to share that connection with someone, especially if you maybe don't live in an area where
Yeah.
there are support groups available, within your town or within your city. So I think the internet can be a really great place as well to get information.
And you're absolutely right. Actually, I just happened to have a patient, head and neck cancer patient, who is a face group called Larry's Speech or something like that. And she met, I have another patient in the past, maybe 6 months ago. Actually, he was my guest on the podcast. I have one of his episodes. Has been one of the ones that people like the most. Has been so like really amazing. So it's a laryngectomy, but we were able to manage to do it with an app on the phone, and then his wife to be able to get him showing his personality and answer the questions. It was really good. So you should listen to it. But anyway, this other patient connect with them. And that's how they end up coming here to UF.
Oh, okay.
So
Okay.
that's easy. And then they were like, coming to see me for rehab. And then finally they got to meet each other last week here because they happened to have an appointment around same time. And they're like, has been the greatest support because, they already been through all this. So they were
Right.
able to advise them into rehab and something like the pump for the head and neck and
Right.
how to do this and how to navigate that, and has been a huge help. And as you mentioned it, all that happened through this Facebook group. And then that really opened all this window to this great healthcare that we have here. And they're doing fantastic. So, and they live in Tallahassee. The other person live in Daytona. So it's like totally, that was a great connection. So that was a really good point there.
Yeah, because I think sometimes these websites, even, I mean, even though they have great information, it can be overwhelming, the amount of information and what's important, what's not important in terms of what I need to know right now. So I think having someone or some people that you can talk to and connect with and get information, and even in your head, sort of helping filter things, of course, in addition to your healthcare provider. But I just think having that support network of people who can empathize and understand what it is you're going through and provide that help to you is really, really important.
Great. Any valuable tips for patients who are going through cancer diagnosis?
Um, I think one is to ask questions, and I don't think this is just specific for people with cancer, but I think anyone that is navigating through the healthcare system is asking questions. Um, Take a family member or a friend with you to your appointments, because if you're getting all this information, there's something that you might miss, there's something that you might not think to ask. I think writing down questions and bringing those with you to your appointments, is a really important thing as well. And then, of course, as a physical therapist, my advice is keep moving. One of the things that we found, especially even people when they're done with cancer treatment, we know that exercise and movement is really important for health-related quality of life, for cancer-related fatigue. But a lot of times patients don't even know, where to start. And so asking your healthcare provider, can you refer me to a physical therapist, or can you give me some recommendations or information about how to get started, with exercise, so I can, start on this process during treatment and then continue it after treatment. So keeping moving is my big one as well.
Yes, and I like to hear that because I even remember 15 years ago when I started doing oncology, a lot of the docs were like, no, no, you're having this cancer, just take it easy, right? Don't do anything. Just don't go play golf. Don't walk. Don't do anything. So that's what we're still at this point seeing. A lot of the caregivers are like, no, 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 my mother or my wife or whatever, they cannot really do anything because they go into this treatment, they cannot move, or the patient himself has such this fear of movement because
Mhm.
they're going to hurt themselves. And in the other hand, actually moving help them to recover so much faster and to be much better prepared for these other treatments that are coming the way. So
Right.
yeah, so has been a lot of really good research about exercise and cancer-related fatigue and some of that mitigating a lot of these secondary cancer effects from treatment. So that has been
Right.
really good. How do you think we can implement in PT school a specialty like oncology to help students to be better prepared for this kind of internship? A lot of the students, I just have literally 2 students who start 3 days ago, and they're like, "Oh my God, this is overwhelming," which is true. It is overwhelming, and I understand that as in medical school, you cannot learn a lot of in depth because it's so much information. Same thing with PT because it's so much information. But what will be your tip, you being in faculty, that we can implement to improve that?
I think at minimum there should be a module on cancer and cancer rehabilitation, which I believe we have here at the University of Florida. I think if the curricular design allows it, for electives, for people to have an opportunity to do an elective in cancer rehabilitation. Obviously, exposure to what cancer rehab looks like in clinical practice is important as well. So people that work in cancer rehab, seeking out PT or PTA programs and serving as a clinical site or serving as a clinical instructor for these students. I think if there were more opportunities, we might see more students choosing to have a clinical experience in cancer rehab, but I don't think we have a ton of opportunities compared to general outpatient PT. And it's interesting because I agree with you. It's a lot of information, but when I think about how we manage or how we treat these patients in the clinic, many of them have musculoskeletal issues that you're seeing in general outpatient PT practice. So just because this is someone who has a diagnosis of cancer and they have back pain or shoulder pain or neck pain or whatever, there's no reason that someone who doesn't have specialty training in cancer can't treat these patients and treat them, effectively. So, and I think that's the other thing is sort of demystifying this whole veil of cancer rehab and what that means and how I have to have all this specialty training. And yes, there's some things that you have to be aware of and take into consideration with our patients who are undergoing cancer treatment.
Yeah.
But they're people with the neuromusculoskeletal system, right? And you know how to treat these issues in other patients. So I think that's the other thing is, we've done a lot of this, I think, in pelvic health rehab and sort of breaking down the wall between pelvic health rehab and orthopedics. And I think we can do more of that with orthopedics and cancer rehab as well.
Yes, and that bring a very good point as well. A lot of the times I hear, again, perfect example, I have a student for Mary Baldwin right now, and I remember she's my student who started 3 days ago, and she's like, well, I understand this is an oncology internship, but I have not have an outpatient ortho yet. Are you sure I'm gonna get exposed to ortho because I will need that part? And I'm like, oh yeah, you're gonna get exposed to ortho 100% of the time because everything we do is neuromuscular system. Yes, flavor of the cancer, and then you're gonna have to learn a lot of things that what happen when the patient is under this situation. But it's the same neck, the same shoulder, the same back that you treat. And so I was asking her actually this morning, that is like, so 4 days later, how much orthopedics have you been done? And she, oh my God, 100% is like, So that's exactly right. So, but I think that if they have that more, like you say, at the school level, kind of have that knowledge and have that kind of a certainty that, yes, this is the same thing that happened on the oncology setting, but you just get all these other things that you need to learn more about it. That will be a really good thing for them so they can give them more experience and choose that better. Like how many times from UF, we have a couple of interns here who came as shadows and they absolutely love it. And so they're here now for their internships. So that's another good opportunity as well.
Yeah, but I think people that work in cancer rehab, being willing to serve as clinical instructors and, I think that's part of the solution as well.
Yep, that is true. Any book recommendations that you have for the audience and why?
Book recommendations. Okay, so I'm actually part of a book club here in town with some of my good girlfriends. It's a group of PTs, mostly PTs actually, and OT. And so the last one that we read that I really, really liked is Covenant of Water by Abraham Verghese. And I mean, any of his books I just think are amazing. He's Indian, he's Malayali from Kerala, which is the same state in India that my parents are from. So, his books, especially this last one, which was based, in Kerala, I mean, there was just so much familiarity to me with it, and it was just a really well-written book. Don't let the size of it scare you. I think it's something like 700 pages. It took a few months to convince everyone in the book club that we could read it, but it was really, really good. The other book that I'm actually listening to it now on audio, it's an audiobook, is The Anxious Generation. So one of our mutual friends, Barb Bauer, actually, Durley, she's the one that recommended that to me. And it basically talks about how today's generation of young people is having issues with anxiety and depression and sort of attributing it to the rise and use of social media. So as someone with 2 small kids and also someone who's an avid social media user myself, it's given me a lot to think about, and also change in terms of behavior. So those are my 2 favorites as of now that I think that I just completed and that I'm currently listening to right now.
Awesome. Great. I will put that on the show notes so people can have access to those. How can people find you?
Well, you can come to the Biomedical Sciences building at the University of Florida where my office is. That's where I am right now. You can find me I'm on X, although what used to be Twitter. I don't go there that often. I'm on Instagram, Facebook, but I have to admit my social media is mostly my dogs and my kids, and I dabble in politics for every now and again. But so it's not really a professional promotion of my work or anything like that. So just disclaimer about that.
I
And my
got you.
email address is meryl@ufl.edu. It's very easy. If you got any questions or anything else you want to ask me about, feel free to email me.
Okay, great, perfect. And again, I will have that as well on the channel so people can see that. Is anything that you've been doing lately on research in regards, yeah, I know you were doing some pelvic health research. What if you just want to kind of give me some flavor of what is the latest things that you guys are looking into it?
Yeah, so one of our just recently completed projects was looking at musculoskeletal pain and sexual dysfunction or pelvic floor dysfunction rather, following gender confirming surgery. So this was a 2-year project. It was funded by the Academy of Orthopedic Physical Therapy, which is one of the components of the American PT Association. And we were just interested in, it's sort of similar to the conversation that we're having today. Patients that undergo gender confirming surgery, typically, they don't get rehab care. Pain really isn't a consideration from their providers. And so we wanted to see, the surgeries aren't the same, but they're similar to surgery. For example, someone that's having a reduction mammoplasty, that's similar to mastectomy, for example. We know that when people have a mastectomy for cancer, they may have shoulder pain, they may have neck pain. Well, do we see these same things in people who have reduction mammoplasty? So we're just trying to figure out, are we missing something? Are rehab providers and rehab services missing in the care of these patients, both leading up to surgery and then following surgery? And so what we found, we did 2 studies. The first was just interviews with people who've had surgery in the last 5 years, and then a larger survey. What we found is that people have a lot of problems, pain with movement following surgery. There's a number of them that have issues with urinary incontinence, pelvic pain, sexual pain, other areas of joint or muscle pain throughout the body, but the vast majority of them are not being referred to OT or PT. And again, this was just a preliminary study to see how big is this problem, or patients saying that this is problematic for them. And so we're hoping to do some follow-up work in this area, potentially looking at the feasibility of adding a consultation and then treatment with a physical therapist before surgery and after surgery, looking at outcomes, that kind of thing.
That's perfect. Actually, I was gonna ask about like pre-rehab. I kind of feel like
Yeah,
there's gonna be such an impact to help that to prepare better for like as we know, anything that you can do pre-rehab is gonna help
right.
better for recoveries.
Yeah, yeah,
Interesting. That's awesome.
yeah. Thank you.
Anything on the cancer realm?
So one of my roles is I'm a clinical research scientist at Brooks Rehabilitation, and they just about a year ago hired an oncology navigator who's a physical therapist, and we haven't gotten started about it yet. We've started some preliminary conversations about looking at how effective, how efficient is the process of oncology navigation. So for example, when someone gets discharged from the hospital, how quickly are they getting or seeing a physical therapist in the outpatient setting? How long is that episode of care? What types of issues are they having? Who are the other providers that they're potentially referred to? That type of thing. We haven't started looking at outcomes per se yet, but we're just looking at the process of cancer navigation.
Super, that's really great. That's
Yeah.
very good. Yeah, that would be, I'm really looking forward for that information. And I know in the past you actually put me in contact with the nurse navigator there and then
Yes.
see like how can we collaborate at one point.
Yeah.
That would be a really good thing to kind of get back into it.
Yeah, and it's one of, I mean, I think I'm really pleased that Brooks, decided to invest in this position and role, because I think it's something that's so important. We know that especially going from inpatient to outpatient care, sometimes there are lapses in
Mhm.
that care. Patients sometimes drop through holes in the system, and so by having someone there that's helping sort of oversee that care and making sure that we don't have these lapses in the system, I think is a really, really important thing.
Okay, great. Is any one question you wish I will have asked you and you will have answered it?
Oh, you should have asked me if I was gonna get another dog.
Oh, well, that's fine. Are you getting another dog?
I don't know. I keep thinking about it. We have two. I'm like, do I want to do 3 dogs again? I don't know. If I did that, my kids would outnumber my dogs would outnumber my kids, so I'm not sure.
Or maybe you're having a third kid coming up.
No, definitely not.
Yeah, so well, it has been wonderful having you, Meryl. I really appreciate, always enjoy conversations with you. It's really
Absolutely.
inspired me. It's nice to have the refreshness and like, let's look at what else can we do to implement quality of life on people. And I think, the research part is huge. Again, to just give us more value and more pull into what we do.
Absolutely. Thank you for having me.
Absolutely. You have a great rest of the day.
All right. Thanks, Durley.
Okay, bye.